In the field, massive hemorrhage is obviously something that we worry about greatly, but in reality it's quite rare. But because it is so serious, it is actually that first letter of the mnemonic MARCH that we use as part of our secondary survey. Remember, M standing for massive hemorrhage. So if you have massive hemorrhage, obviously applying direct pressure is your first approach, but your second approach, if direct pressure doesn't work, is going to be applying a tourniquet. Now, if you don't have a prefabricated tourniquet, you're going to need to make one. And it's actually quite simple, again, using tools and equipment that you probably already have. For this, you're going to need 2 pieces of cloth, or in this case, we're going to use 2 triangle bandages, and you're going to need some sort of a rigid stick. Tent stake works great, a fork, a knife, a stick that's quite sturdy, because you're going to create what's called a windlass. Now that is basically that device you see on those prefabricated tourniquets where they're twisting in order to actually increase the tension and close the space within the extremity that you're applying the tourniquet to. Now when you're using a tourniquet, a couple things to take into consideration. One is going to be the rules of 2. You want your piece of cloth, in this case the triangle bandage, to be 2 inches thick, and you want it to be at least 2 inches above the wound. And that's because if you do have an arterial wound, it's not uncommon for the artery to retract in the extremity some bit. So you need to be at least 2 inches above the wound. Once you've applied the tourniquet, as we're going to demonstrate in a moment, and you've cinched down the windlass, the second piece of triangle bandage will actually be what holds that tent stake or the windlass in place. You need to apply the tourniquet and tighten it until you lose complete arterial flow distally. So in the upper extremity, that's going to be checking the radial pulse. In the lower extremity, that's most commonly going to be your dorsalis pedis or your posterior tibialis pulse. So you're going to make sure you go until you completely lose pulses in that. That's going to be quite painful often for the patient, so you may need to treat them with some sort of pain medicine, but ultimately pain is going to be better than exsanguinating and dying. So other things to consider when it comes to the tourniquet, and this is a big one, is if you apply a tourniquet, you want to record the time that it's applied. If you have a piece of tape that you can apply to the patient and write it down, that's great. If they're going to be evacuated and on a litter, just write the time on their forehead. That way nobody can miss it and everybody knows how long that limb has become ischemic. That'll actually give them a good idea about the prognosis of salvaging that patient's limb when they get to advanced medical care. In order to create the improvised tourniquet, again, you will need something rigid. I have a tent stake here. And then for our purposes, we're going to be using 2 triangle bandages. You can use anything, but remember that it needs to be at least 2 inches in thickness or width. One thing that's interesting, triangle bandages, when they come straight out of the package, they're actually about 3.5 inches across. So that gives you a nice measurement that you can pretty much use straight out of the package. So I'm using this piece of tape, this sticker here, as my marker for where the wound is. And remember, we're going to need to be 2 inches, at least 2 inches proximal from the wound. And you'll take your bandage and you'll tie just a simple overhand knot. Nothing fancy, just like you're starting to tie a shoe. Give it a little bit of a cinch down, and then you will lie your tent stake to create your windlass in the long plane perpendicular to the course of the extremity and the triangle bandage, and then you'll tie another knot over that. And I prefer to make it in a square knot, so going the opposite direction of my initial knot. And you'll get your tent stake to sit quite nicely right there. So that's the first part. Now you've created the windlass, and now you actually need to start turning it. And this can be pretty painful for the patient, so if you have some mode of analgesia, that's preferred. You'll notice that the tails in this situation in the improvised tourniquet do get in the way, so you will need to annoyingly continuously move them out of the way. And once you've gotten to a point where you feel like you're tight, you will then check the pulses distally to the wound, making sure that pulses are absent. And at this point in time, you'll hold it still, and if you have an assistant or someone else there, they'll take that second bandage and you'll go around the extremity, and you'll actually want to be proximal to the actual tourniquet itself, and you'll tie a simple overhand knot, back it up with maybe a square knot or 2 overhand knots. Remember, if you don't know a knot, just tie a lot. And again, with all these tails, it can be a little cumbersome, but as you can see now, I have my tourniquet in place. It might slip a little bit as you have applied that secure bandage, but that's when you want to recheck pulses, and if pulses have returned or bleeding hasn't stopped, you're going to reapply the tourniquet. So one quick tip is, in some situations, you can actually So one quick tip is that if you're having trouble after you apply the secure bandage, that the windlass is still continuously shifting too much or actually coming undone completely, you can actually shift the tent stake up and down to give yourself a little bit more purchase here. And then one thing you can do is you can tie just a simple overhand knot in that security bandage and actually slip it under your tent stake or whatever is you're using for your windlass. And now you see that I've got an overhand knot underneath it, and then I'll tie just the same way I started my tourniquet. I'll tie a square knot on top of that, and that'll keep it in place. That's not gonna move at all. That's gonna sit there nicely. A few final notes regarding tourniquets is you generally want to leave them on for somewhere between 90 minutes and 2 hours before you reassess to really give it a chance to clot off and obtain any hemostasis. So it is recommended that after about 90 minutes to 2 hours again, to actually slowly release the tourniquet, assess distal pulses, and see how the bleeding is doing. If the bleeding is controlled at that point in time with just direct pressure, then I would leave the tourniquet on the extremity, but have it relaxed and completely released for blood flow, knowing that if it needs to, it can be reapplied quite quickly if the bleeding should start again. In general, tourniquets have been in place somewhere between 4 and 6 hours without any long-term effects, because ultimately you need to focus on their life first before you can focus on their limb.